Oncoplastic breast surgery is the integration of oncological procedures with plastic surgery. So what the oncological procedure means, taking out the breast cancer and ensuring that the margins are clear, and combining that with different types of techniques of plastic surgery. So at the end, and the outcome we want is for a patient is the cosmetic outlook that either is the baseline of the patient, of where they started off, or is not too dissimilar. And that is the key for this. So oncoplastic breast surgery are more beneficial compared to the previous traditional operations. Though you still use the traditional operations to take the tumor out, be it a lumpectomy, a quadrantectomy, which fall under the broader spectrum of wide local excision. The key is to ensure that the cancer is out, but at the same time, you want to leave the patient with an aesthetic looking breast. And therefore, the outcome is to reduce the mental and physical burden that a patient may feel throughout their cancer journey. And that is the benefit at the end by doing oncoplastic breast procedures. There are many techniques in breast oncoplastic procedures. There's not just one method. But importantly, things like just a simple aesthetic scar placed where the patient, you can hide them, see, be it if they're wearing a bikini, you don't really want to see this scar, to slightly more complex, like a round block, therapeutic mammoplasty. So the procedures are not just, and the techniques are very much decided when you first see the patient. So when a patient walks through the door, I need to know is the biology of the tumor, the size of the tumor, and then the patient characteristics. Therefore, the final decision and the operation that we choose for that particular operation will be very much dependent on these characteristics. And so I can't, if somebody walks through the door, I can't just say, okay, a round block is suitable without actually understanding, because we need to ensure that the cancer is removed, but at the same time, can I leave them with a very similar breast at the end of the day? So I can reel out a whole list of patient operations that we can do, but it's very much down to an individualized process for that particular patient. So the way I look at it is that oncoplastic breast surgery techniques and operations are now the standard for majority of breast surgeons. And so when I see a patient that walks through the door, everyone's suitable for an oncoplastic procedure. Of course, there will be some patients who've had previous breast cancer surgery and there's a huge volume deficit, then it may not be suitable. But importantly is that for me, when I first see a patient, is to understand the biology of the tumor, as I've already explained, and then also the patient's characteristics such as the body habitus, the breast volume. All these will make a difference. And I think at the end of the day, we need to ensure that that is suitable for that particular patient. So for me, it's now the standard. Therefore, I think everyone should be recommended it. Again, is the procedure suitable for the patient? Yes, definitely. I think, so again, it all falls down to the basics of the biology of the tumor and the patient characteristics. So for me, the way I think, each procedure may be suitable, but there are some patients that you may not be suitable. And those are the ones that we need to really carefully think about. Patients that are on steroids, who've had a long-standing chronic illness, they're not able to tolerate longer procedures, or patients that are smokers. So we have to be extremely careful for those kind of patients and what technique we offer. We still do it in them, but I'm extremely cautious because there's higher risks of complications in those kind of patients. Not that it stops us from doing them, but I think, it's a whole consenting process and they need to understand why it would be a higher risk in doing them in the long run. Then it involves the patient coming in and out of hospital, sometimes more often than the usual way. But these complications can happen in most patients, but much higher in these particular things. So I still think, again, it's very important that most procedures are suitable for, again, according to the breast volume and the cancer characteristics. So when a patient walks through the door, and I've now been a consultant for 8 years, I've now noted that the oncoplastic procedures that we've been doing, say when I first started as a consultant, is very different from what we're doing now. So time has moved on quite a lot, and advancements in breast oncoplastic procedures, where before we were very wary about the final cosmetic outcome with using implants, expanders, using own traditional uh, methods such as their flaps. But where I used to put a lot of temporary expanders in patients that needed radiotherapy, we found that the papers and clinical evidence is now there to suggest that the cosmetic output is not as different. Say, in a lot of patients now, leaving a nipple behind is actually far more aesthetically pleasing, and therefore we're able to do pre-PEC reconstructions in most patients that are doable. But if they're very, very large breasted or ptotic, then of course that may not be suitable, because then the implants are much larger. And I still think, so so for me, when a patient comes through the door, I have lots of folders of different types of operations. And I find that is particularly quite nice for them to see, because if you use standard imaging from the internet, they are not your patients. They may be a variety. The body habitat is not very similar. So I'm able to show them all different types of procedures similar to them. And I find that is, they understand that much better and how they would look. Of course, we are now going down to the era of using cameras, 3D cameras, where you take a patient's photo and actually show them what they would look like, where the scar positioning would be, because drawing it schematically is not the same. But using a 3D camera, you can reflect them and they actually see it. So for them, it is far better that if they look and say, okay, actually this is quite okay, and I'm able to overcome these operations. And I find, smaller scars, less painful, their recovery is much more better. And I think that is the way forward, is to make it very individualized and to show them real pictures.